Hi everyone, good morning. The case study I chose for this week was Sharon, a 64-year-old woman with obesity who complains of bilateral knee pain. She describes the pain as aching around her knee. Sharon's presentation points strongly towards osteoarthritis. That was what I chose for the my main primary differential diagnosis. I chose that based on her knee pain that worsens with activity like walking upstairs, limited range of motion, her age, the fact that she's female, and her obesity. Um, a quote I got from Chiacolio 2022 is, "It has been observed that cartilage degeneration is preceded by subchondral bone lesions, suggesting that a key role of the mechanism within the pathogenesis and progression of osteoarthritis as well as the formation of ectopic bone and osteophytes. Moreover, low-grade chronic inflammation of the synovial lining has gained a central role in the definition of osteoarthritis pathophysiology." And that's kind of what they're saying is the leading cause of osteoarthritis. Other things that could be differential diagnosis is she could have a possible meniscal tear. Um, and it could be rheumatoid arthritis, but it's not consistent with her symptoms that she's having. The next question was, what are the risk factors for developing osteoarthritis? Risk factors are her advancing age, she's female, her BMI, 32, the fact that she used to be athletic, so overuse of that joint. She now has a sedentary lifestyle. Those are some of the things. The prevalence of osteoarthritis continues to rise, particularly affecting women, with unclear distinctions in risk factors and treatment response between the sexes. And that's from Cortez 2024. What are the diagnostic tests used to confirm osteoarthritis? Well, there's imaging, is the first, and that would be an X-ray or an MRI, which is not routine. Labs would be the ESR and the CRPs. The next are, what are the non-pharmacological and pharmacological interventions for managing osteoarthritis? Non-pharmacological, of course, is more lifestyle management with weight loss, exercise, um, using braces and things like that, and heat and cold therapy. According to new evidence, the prevention and the conservative treatment of osteoarthritis acquires an important role in the surgical approach. Consequently, interventions must be emphasized to counteract the modifiable barriers that drive out disease progression. These interventions should include, for example, treatments for obesity, approaches for improving joint mechanics. Importantly, these interventions must be instituted before considerable structural and functional alterations develop in the joint tissues. And that's from Cocholia 2022. Pharmacological interventions are NSAIDs at first. Of course, that's first line. And topical things like diclofenac, oral NSAIDs as well. Um, Tylenol, but that's less effective. Corticosteroid injections, um, but those can't be constant or continuous. So, newer therapies are hyaluronic acid injections. Duloxetine can be used for management of pain, and really just to avoid using opioids as much as possible. Treatment advances in hand and knee osteoarthritis underscore the evolving landscape of therapeutic options, from stem cell therapies to pharmacological targets like the ADAMT5 inhibition. However, challenges persist as evidenced by negative trials and inconclusive findings in certain intervention. Moving forward, efforts should be prioritized comprehensive risk assessments, innovative treatment modalities, and patient-centered approaches to mitigate the growing burden of osteoarthritis, and that's Cortez 2024. Um, Now, what is an indication for referral to orthopedic surgeon? Would be severe pain that's not managed well with lifestyle and medicine therapy. If it's significantly affecting their activities of daily living, if you see damage to the joint on an X-ray or an MRI, those would all be reasons to refer it. Um, so the the takeaway from here is that she has bilateral knee osteoarthritis due to the fact that she's female and her overuse of the joint and her weight. And the therapies for that would be some lifestyle modifications, diet, exercise, losing some weight, and then some pharmacological interventions as well. Thank you.